Everyone, Dr. Lisa Palmer, Dr. Mama Bear on parasites, puking, and patience. It is going to be a full moon this Thursday, so a couple days, going to be a full moon. What the heck is up with full moons? Why do I care about full moons? When I was in college, I was actually in an astronomy class as a freshman, and I thought, why? I'm a sports medicine major. Why would I care about astronomy? Like, what do I care about planets and moons and stars? And I just had this very narrow viewpoint on working with athletes and working with the body, and who cares about planets and moons and that kind of thing. Well, some of you guys know that the moon does have an effect on our tides, and farmers can tell you that they may plant crops at different parts of the moon cycle. Fishermen may tell you that they will or will not fish at certain points of the moon cycle. Emergency room departments will tell you that full moons tend to bring in like crazy patients. So why is that, right? Why is it that things happen around full moons? Well, there is a reason why. I would say the majority of the cases that come into my office that are mystery cases or difficult cases, or the patient went to this specialist, they went to that specialist, they had this imaging, they had this thing, they had these things done, and the physicians could not find the why. They could not find the cause. And so the patient got frustrated. The patient either thought they were just stressed out and they needed a psychiatric drug, which is never the reason, because if you look up those things on drugs.com, an antidepressant causes depression, and anti-anxiety causes anxiety. And so what is the point of taking a medication that will never fix the cause of that? The most common thing that we see is missed in our office is an immune challenge that's parasitic in nature. So what the heck does that mean in English? Because I try to talk to patients in English and not in doctor language. It means that you got bugs, right? So when you see your dog scoot its butt across your carpet and you think it's funny or you think it's gross, it's because your dog's anus, your dog's butthole itches. Why does it itch? Well, because your dog likes to eat cat poop or chicken poop or dead things or whatever, and they get parasites, right? People get parasites too. Where do we get parasites? We can breathe in parasites. We can eat parasites. How do you eat parasites? Well, if you have sushi and you have not cooked fish, the fish can have eggs, the fish can have parasites. You consume that and it goes into your system. Not cooked enough pork. Don't ever eat pork that's red, right? Or pink. Some chefs like to keep it pink. Pork parasites are very dangerous. You can get parasites from undercooked meat. You can get parasites, vegetarians, you can get parasites in produce. You could get parasites that enter from the bottom of your feet walking barefoot. You can get parasites that swim into orifices. So unfortunately, here in Florida, or fortunately, we have lots of pools, swimming pools. And unfortunately, chlorine does not kill parasites, whether it's in your water supply or in your swimming pool. Parasites are in lakes, parasites are in rivers, parasites are in the ocean. And so these suckers swim into holes. So if you have a hole in your body, it can swim into that hole, like up your nose. So there's lakes here. We're in Central Florida. And at one point, there was a high amoeba warning, because if you're swimming in one of the lakes in Central Florida, amoebas can get into your nose and go into your brain, or get into your system from the beach, or from the food that you ate, or from your pet, or whatever. And so these parasites can cause some really nasty symptoms. Starting at the top, you can get parasites in the brain, and they show up as brain lesions in CT scans and MRIs. They can contribute to migraines. They contribute to headaches. They can get into the eyes, and there's a reason for floaters. So your eye doctor might say, oh, well, it's just a floater. What the heck is a floater? A floater could be a parasite that you're seeing in your line of sight. They can get into your ears. They can attack the thyroid and cause autoimmune issues. Autoimmune is like me punching myself in the face, which I wouldn't do. Something attacks the thyroid. It could be a parasite. They just couldn't find it on imaging. They can get into your esophagus. I had a patient who felt like something was always stuck here, and it tested for a parasitic type reason. It can get into the lungs. So those that have like a hacking cough, or those that have bronchitis or asthma, could be parasites in the lungs. They can get into the heart. You've heard of heartworm? No. You've heard of heartworm? So that could be an issue. They can get into the stomach and cause bloating, diarrhea, nausea. They can get into the small intestines and cause ulcerative colitis, irritable bowel syndrome, explosive diarrhea, mucousy diarrhea, bloody diarrhea. They can get anywhere in your system. And unfortunately, they're very, very hard to find in medical tests. You can have an OP test where they look for eggs, ovum, in the poop. That's difficult because if my finger represents the fecal log, if you will, and they scoop the poop, if you will, and they slide it under a microscope slide, it could be very challenging to get the exact right piece that has the parasite in it. And then some parasites won't be coming out in the feces because that's not their exit channel. They're very, very happy living in your heart, or they're very happy living in your pancreas and bothering your blood sugar, contributing to imbalanced blood sugar levels. You can do a blood test, and parasites like malaria could be found there. But again, you're looking at a drop of blood or taking some blood vials. Are they going to find them in there? They may not. They can do a live blood study. That's really interesting to see parasites wiggling around in the blood. Live blood studies, actually, out of all those tests, you may find them the fastest. You could do a colonoscopy where they stick a camera up your butt while you're unconscious and take pictures. Might see them there. They can do an endoscopy that goes through the nose or the mouth and take pictures. But they're very, very challenging to find. And because they're so sneaky and they're hard to find, they go often unnoticed, they go often undiagnosed. And so the person is suffering with all of these conditions head to toe, including skin irritations like rashes, eczema, psoriasis. And it's going undiagnosed, it's going unknown. And so the person's just taking medications that suppress the symptoms. So they might put like a steroid cream on their arm, but they didn't fix the cause of why their arm has the psoriasis. They didn't fix the cause of why the arm has the rash. They didn't fix the cause of why they have horrible migraines. They didn't fix the cause of why they have explosive diarrhea. They didn't fix the cause of why they feel nauseous all the time, because they couldn't locate the cause with medical testing. And I get it. I understand. I was a failed medical case. I had extreme dizziness. My ears were messed up. For a couple of days, I was stuck bedbound because I was so dizzy. The docs could not find why. And sometimes when a doctor can't find why, they think it's all in your head, right? And so I'm a doctor, and I had this doctor evaluating me because I felt so bad. Kind of hard to evaluate yourself when you feel that bad. And he's like, Doc, your blood work's fine. Your blood pressure is healthy. Your heart rate's healthy. I can tell you're an athlete. I can tell you work out. I can tell all this stuff. And so on paper, you look really healthy. But in real life, when I look at you, I see that you're pale. I see that you're dizzy. I see that you don't feel well. He goes, so Doc, well, maybe it's just stress. And maybe you need something for stress. And I'm like, well, I've never had a patient doctor come into my office and say, yay, I feel horrible, right? Like typically people are a little sad or not very uptone when they don't feel well. And just because he could not find out the reason, I actually said, just because you can't find out the reason doesn't mean it's in my head or it's stress. And then later on, doing some specific nutrition work, found out that it was mercury, a toxic metal in my pituitary gland that was shutting things down and making me dizzy and making me gain weight and making me have skip periods, and it was horrible, right? And then later, after testing, found out that I had parasites. And that's why from the time I was a kid, as long as I could remember, I was nauseous pretty much every day. I had food poisoning more times than anybody should have food poisoning. If I had the exact dates and times, I might even be able to go back and look, was it near a full moon or a new moon? Because parasites become more active. If you're digging for worms, you're going to do that during a full moon because the parasites or the worms are more active, right? And so parasites become more active during full moons. So if the parasites are in the brain or the stomach or the heart or the lungs or wherever they are, they're going to increase symptoms in that area. That's why emergency room departments will tell you. I've asked them, hey, are you guys busier during the full moon? And they laugh. They're like, oh my gosh, yes, we are. But they don't know why. I know why. I know why. If the person has parasites, and a good chunk of our population does worldwide, then any symptoms that are amplified by the full moon will also increase. Parasites love sugar, so cravings for cookies, candies, ice cream, um, alcohol. Alcohol is sugar. And so they consume these products. If it's an alcoholic, they increase their alcohol, and then they have weird behaviors. They might even have medical issues. They might even have conditions. Selena's asked me in the chat, how do parasites in the brain come out? So I had a case. Um, uh, so I have multiple cases, but I had a case that had migraines and seizures. In every single migraine case I've ever worked on, we found a parasitic problem involving the brain. And so, one case in particular, she had seizures and migraines. She told me her migraines were so bad she wanted to chop off her head. She was not suicidal, she was just describing the pain. And as we started to detox with very specific products in a very certain way, because parasites in the brain, you're right, Selena, you can't just poop those out. The body has to break them down. So the brain cases, we have to we have to really know what we're doing. And as we detoxified the parasites and the chemicals and the heavy metals and the other things that we had to handle in this case, her seizures decreased, her migraines decreased, and now it's been 12 years that she's been seizure and migraine free. I had another case out of South America, and she told me, Dr. Palmer, you're never going to believe this. When I was a kid, I felt crawling in my brain. Did that give you guys the heebie jeebies? She felt crawling in her brain. And she went to a doc, and I find that doctors, non-American medical doctors, are much more open to parasites, right? So doctors in Latin America, doctors in India, doctors in China, doctors in the Caribbean islands are way more open to parasites because I believe their training includes parasites, right? They're aware. A lot of the Caribbean islands do once a month what they refer to as blowouts, where the whole family does a deworming. You can think of like your dog takes one time a month heartworm pills, which is deworming. You deworm puppies, you deworm kittens, you deworm baby horses, right? You deworm animals in the veterinary world, but why don't we do that in the human world? And a good chunk of our world does not, and a good chunk of our world does that as part of what they did as a family, as their culture to stay healthy. In India, in elementary school or grade school, the teacher gives you a box for a fecal sample, and you bring it back to the teacher, and the Department of Health will run a parasite cleanse on the elementary school. You know, of course, I can make some poop jokes on that day, like the teacher's day. She had a shitty day, right? You know, can you imagine 50 little kids bringing in you boxes of poop? Like, it's an interesting day, right? But the whole point is that teacher or that country understands that parasites cause problems. So when it comes to parasites, lesions in the brain, and again, there's many, many cases. This one out of Latin America, she said, yeah, I felt crawling. My doctor understood that parasites can exist. He cut open her skull and he pulled out parasites out of her brain. That's crazy. There's a show called Monsters Within Us. And they also show cases of doctors pulling parasites out of different random parts of the body, right? And so with a case, so she had that when she was younger. I do not believe that is a proper way of handling that, because you're not getting the eggs out, right? You're only pulling what's visible. And what a traumatic way of doing that, cutting open her skull and putting her under general anesthesia or whatever it was. That's kind of a traumatic, that's not kind of, that is a traumatic way. Instead, we can use very specific herbs and very specific homeopathy, making sure that the detox pathways stay open and detox it out that way. So the body, the lymphatic system will bring the herbs, bring the homeopathy to the area. It will dissolve the parasites. It'll go through the lymph, it'll go through the blood, come out of the brain, and get processed in the kidneys or the bowel or whatever. And so Jessica says risk of infection. Yeah, you're cutting open the head. That's definite risk of infection. It's a risky way of doing that, right? Cutting open the brain. We do not do that at our office, just to clarify. Instead, we look at what specifically does that person need to rebalance the body. So that's what we're looking for. That's what we're doing with the bugs. And so too many kids, including myself, had food poisoning where you spend the whole night puking. Some of you guys have kids right now with upset stomachs. They spend the night with an upset tummy. One of my friends, she's like, yeah, you know, all my boys, they have stomach aches again, and everybody's puking. And I'm like, yeah, well, when it's like that, and it's specifically a time of the month, it is very likely that it's parasites. And with little kids, we have different liquids we can give them. Very, very safe, very, very easy. They taste sweet, so that part's easy. For adults, we can use a little bit harsher herbs if we need to, and we handle it. And we handle it, and people get better. And so for me, I was nauseous every single morning, never wanted to eat breakfast, wasn't a breakfast person. And I handled parasites in my 30s. And I'm like, wow, I can have breakfast. I can actually eat in the morning. I actually like breakfast, right? It's not my favorite meal. I'm a dinner person, but I can eat it now and not feel nauseous. Knock on wood, I haven't had food poisoning in years, right? And so with patients, one of the most common things that we see that is missed are these little creatures that can enter through the food that you eat, the air that you breathe, the water you drink, the water you swim in, swimming pools, lakes, beaches, that kind of thing. So if I ruled the world, everyone would do a practitioner guided, not a random one, but a practitioner guided parasite cleanse, because if you live on planet Earth, you got bugs. You got bugs. So I'll hang out for a little bit of questions. You guys can let me know if you have questions on parasites. I'm happy to answer. Going from top of the body to bottom of the body, I've seen parasites contribute to everything from headaches and migraines, floaters in the eye, changes in vision. I had a patient, she had this, I don't know, Jessica, maybe you know the right dental term, but she had this like bubble in her gum, and her husband was a dentist. And her husband's like, okay, no problem, honey. We're just cut open the bubble, cyst, whatever it is, and drain it. And she went to see me, and she's like, well, what do you think? I'm like, well, I'm not a dentist. I'm not going to compete with your husband who's a dentist, but let's test that and see what the heck it's testing for. So it tested for the frequency of parasites. And I said, I don't think that's a good idea. The body puts things in bubbles, or puts things in cysts, or puts things in lesions to protect you from stuff. And so it says parasites. I'm like, if he were to incise or open up that bubble, what's going to happen? All the parasites are going to fly all over the body. It's kind of like if someone has a cyst. I had a patient, she had a cyst on her kidney, and the docs were like, well, it could be cancer, so let's just take your kidney out, like it's like a spare parts or something. And I'm like, yeah, let's not just take your kidney out. Let's quantum nutrition test what the heck is the cause. It's a very specific technique. Let's handle that problem and see if the body can heal. And there's a time and a place for surgery, right? I have nothing against the medical profession. Medical doctors saved my life. I was an emergency C-section. I'm very thankful. Medical doctors just saved my father's life this year. So I'm not anti-medicine. I am anti just prescribe random stuff. I am anti just cut out random stuff. I'm not okay with that. Cut open somebody's head. I'm not okay with that. Emergency surgery, those types of things, bone sticking out your arm dangling by a thread, emergency C-sections, because lives are at stake. I am very, very supportive of what those docs do. But when it comes to chronic conditions or mystery conditions, sometimes they have difficulty of identifying them. And I don't like the whole saying, when in doubt, cut it out, right? Your gallbladder is acting up. Let's find out why the gallbladder is acting up. If you have abdominal pain, let's not do exploratory surgery. Let's figure out what's going on. Is it parasitic? Is it that you've been on rounds and rounds and rounds of antibiotics, and your microbiome of your gut is so destroyed that it can't handle anything? It can't even help you with digesting food because it's too destroyed. Let's find out the cause of the anxiety. Stress and anxiety sometimes is because you have a deficiency in B vitamins. You burned up all your B vitamins, and now you have nightmares because you don't have any more B vitamins. You burned them all up with stress. Maybe you have weird muscle cramps, or you have muscle uterine cramps, right? You have period cramps because your magnesium levels are very, very low. Many people are eating DoorDash, Uber Eats. I take advantage of it from time to time. And there are people that don't cook anymore. Well, the problem with that is that restaurant food tends to not be as high quality as if you cook the food yourself. It tends to have extra chemicals. It tends to have preservatives. It tends to have artificial sweeteners and dyes. And then it may be cooked in bad oils like canola oil. It may be cooked in vegetable oil, right? These are oils that could be rancid, meaning that they don't turn over their oil, or they don't change their oil that they fry in often enough because it's a cost or because it takes time. And then they're using lower quality foods because it's cheap and they have a better bottom line. They're making more profit. And so if you have unexplained nausea, if you are not feeling well, if you have bad energy, if you suffer from nightmares, if you grind your teeth at night, if you have weird rashes, if you have Crohn's disease or irritable bowel disease, and the quotes are like this because your symptoms were labeled and put into a category, but the cause wasn't found. If you have any of these symptoms, then there is hope for you. And we can help you at my office, Palmer Natural Health. We can help get all the data from you, listen to your concerns for about 30 minutes, grab all this information. We then take that data and we use a very specific technique called quantum nutrition testing to determine what areas of the body are balanced, what areas of the body are not balanced, and why. Instead of suppressing the symptom with a medication or covering up the symptom with a medication, we're going to give the body herbs, we're going to give the body homeopathy, vitamins, minerals, electrolytes to rebuild the body. And when you rebuild the body, finding the cause of the problem, the person gets better. And then the diarrhea, IBS, Crohn's disease, psoriasis, eczema, nightmares, teeth grinding, black circles under the eyes, vomiting, bloating, you name it, goes away, not because we cured it, not because we treated it, but because we rebalanced the body in a natural way by identifying the causes, identifying the imbalances, and then, maybe peeking at your food, Um, I've had patients that are like, I'm gaining weight, Dr. Palmer. And I'm like, okay, well, let's take a peek on what you're consuming. Oh, yeah, well, you just ate a whole key lime pie. I don't even know. I think I looked it up at one point. It was like 80 grams of sugar. And I don't even remember how many calories. It was an insane amount of calories. She probably had parasites at the time, if I remember correctly. And I'm like, of course you're gaining weight. You ate a whole key lime pie, right? So sometimes we need to guide people a little bit on their food. What's really interesting, though, is if you do have an immune challenge that's parasitic, parasites will make you crave cookies, candies, ice cream, sugar, alcohol. And as we rebalance the body and rebalance the microbiome and rebalance the gut, the body doesn't want the sugar anymore. And it's interesting that the cravings for the donuts and the cookies and the candy and even the alcohol, I've seen this in alcoholics, diminish, decrease, and then go away. And sometimes I tell new patients that I'm like, yeah, I know, you really love your organic chocolate, or you really love your cookies, or you really have to have your sweet. I mean, I was a Starbucks caramel macchiato with the caramel drizzle, right? That was my Starbucks drink. And now I look at that and I'm like, oh my gosh, like just the pump. What's one pump of vanilla syrup? I don't even know how many grams of carbs and sugar that is. I've looked it up. And most people get multiple pumps of different things. I saw one time, it was behind a lady at Starbucks. She got my old drink, which is the caramel macchiato. And then she asked for extra caramel. And then she asked for extra vanilla pumps and extra whipped cream. And I'm like, oh my gosh, that's like diabetes in a cup, right? And then, of course, I'm looking at her from a doctor standpoint, and I'm like, oh my gosh, like this lady is setting her, if she's not already diabetic, she's setting herself up for diabetes. And she has such intense sweet cravings that she wants caramel on her caramel. Most likely, it's not lack of willpower. It's most likely the parasites demanding her to have sweet things because they can change your physiology and they kind of like control you. They're parasitic, right? They eat from you and it causes problems. Let's see. Thank you, Lucy Lacey. Great to see you too. My awesome, sweet husband helped me with a technology problem, so I'm able to stream on all my channels again. So I'm getting to see some of you guys I haven't got to see it in a bit. You're welcome. Awesome. So again, if you guys need help, if you think parasites might be the cause of your problem, if you have unexplained mystery illnesses or symptoms, or you're just tired of being tired, call my office, Palmer Natural Health, 407-682-8444. We do telehealth. We do take clients across the United States. We do take clients internationally. My Australian clientele, you guys are a little bit challenging to schedule with the time zone, but we got to figure it out. If we can help you, let me know. Reach out, give us a call, and I'd be happy to help. I'm Dr. Lisa Palmer. I almost said Dr. Lisa Pamba. Dr. Lisa Palmer, Dr. Mama Bear. Good night, everyone.